Hi there, Dr. Davenlin, board certified laser dermatologist. Hey, today's topic we'll be talking about how to assess acne scars. That is, how you can assess your own acne scars or acne to see whether it's potentially scarring. That way, when you go to your doctor or your beautician or esthetician to get your scars revised, at least you have some idea of what to expect and what devices can be used. Acne scars can be complex, and certainly you can class them into different types, medically, whether they be grade 1, grade 2, grade 3, etc. Or can class them in regards to the subtype, whether they're box scar scarring, ice pick scars, rolling scars, atrophic scars, hypertrophic scars, macular erythema, or even post-inflammatory hyperpigmentation. So we call macular erythema and PIH, those are color changes. So I'll show you in this video how to actually assess your skin to see whether your acne or your acne scars really do need treatment. Look, this is just one of 4 laser rooms that we have, and you can see how many lasers there are here. Most of these lasers are used to treat acne scarring. I say lasers are laser energy devices, so my favorite so far is the Infinity for acne scars, but certainly we've got fractional and fractional lasers, erbium, the whole lot. But hey, at the end of the day, you may not need any of these procedures. So I'll show you how to actually assess your scars and what procedures you may or may not need. Thanks for watching, and remember to subscribe for more info. Okay guys, so how do we actually assess acne scars and know when you should need treatment or when you can actually wait? The best thing to do is angle lighting. You can see from this picture over here with direct lighting, you can see that this gentleman has some scars. But if we put some angles of light, you can see a lot of what he has is actually pigmentation, in other words, redness, as compared with this lady here who has redness, but if we put some angles of light on her, you can see she's got depressed scars. So she will benefit from scar revision whilst the gentleman won't. And scar revision for treating redness is really easy. That's with a vascular or V-beam laser. So most patients undergo 3 to 4 treatments, 3 to 4 weeks apart for good improvement. So brown and dark acne scars, these are very, very common and secondary to inflammation. So they're called post-inflammatory hyperpigmentation and are super common following acne. Now the best treatment for that is actually using what's known as a Picot laser. It gives great treatment with very little downtime because it treats both the brown bits but also stimulates collagen production. So we can reduce the amount of pigmentation markedly over 2 to 3 treatments, and instead of taking months, it can actually fade within a few weeks. So post-inflammatory hyperpigmentation is very common. It's more common in ethnic or darker skin types, and with the use of Picot lasers, it can actually help tone skin pores and remove pigmentation as well. So tangential or angled lighting is extremely important to examine scars. And here I'll illustrate, and once again illustrate, keep reinforcing, you need to actually have this kind of lighting. If you're a specialist or person who's attempting to resolve your acne scars, does not do this kind of lighting, they really don't know what they're doing. You can see the difference once we put angle lights as to how we actually target the scars. This guy has got atrophic scars in the middle of his cheek. Nothing's going to work except for either fat grafting or dermal fillers. And same with this lady here. Angle lighting tells us a lot. Straightforward lighting certainly can tell us that she's got lots of different types of scars, including tethered scars, mixed scars, rolling scars. But with angles of light, we can see where the atrophic scars lie and where to target our approaches and treatments. So this is extremely important. And another case here, this gentleman complains of scars on his temples, but once you look at it, you go, hey, there's not much happening there. But once you actually put angles of light on this area, you can see he's got marked scarring, really deep, severe scars, and these improve markedly with subcision together with dermal filling. And same with this lady here, marked atrophic scarring. The only way to fix that is with dermal fillers. You can't laser that. So how do we assess tethered or anchored scars? You have to actually get patients to animate. That's why when patients send me photographs, I can't really make any comments on what they have. I really need to actually see them because animation tells me whether they've got tethered scarring or anchored scarring, and these do well with subcision or surgical procedures. So you can ask them to smile, and you can see if it puckers in, there's some pulling in of the muscles. So how do we remove scars? Well, look, how I do it is that I tailor each individual as an individual and treat their scar type rather than actually put them on a laser device or a filler. Each patient is unique. Everyone who walks in has a different set of scars and scar type, and hence will benefit from different procedures. Most patients will require a combination of procedures, everything from laser resurfacing to Infinity to fillers to TCA cross and a whole heap of others. So filling. I use a combination of dermal fillers together with surgical subcision to raise the scar up. Watch closely and I'll show you how it's done and the before and after results. This is how I perform the procedure. So this is my way of filling acne scars. The first thing I do is examine them under indirect angle lighting. So this is the best way to actually examine the scars. Now you can see me filling. So I'm filling once again with the light to the back of me. So that way I can see the shadows, and I'm using a superficial filler. So look, what do we see 2 weeks later? Quite an improvement. You'll see at least realistically a 95% improvement after just one session. So I'm using, in this case, Juvederm Verbella, but in the US there's Bellafill. So often with my filling techniques, I combine subcision and also dermal filling. So if there's something to subcise, I subcise. If not, I straightforward fill the area. So this is what we call a modified Greg Goodman's vertical filling technique. Dollop filler in the base and tapering to the top. So many different filling methods. Now we come to other devices such as skin needling, dermal rollers, and energy device microneedling. I've really stopped skin needling. That's really archaic. It's 20, 30 years old, and a device such as this, a skin roller, yes, it can work for mild scars, but they're much better delivery systems. In fact, if you're going to use something, use a vertical delivery system because it provides less trauma to the skin compared to tearing of the skin compared to skin needling. So skin needling, does it work? Yes, but are there many other treatment options that are better? Absolutely. So I've really stopped using rollers, and you can see why. It's because stamping equals less tearing, better results, and less trauma. So my go-to device now is what's known as energy device microneedling, which is insulated, and Infinity is the latest. It's the insulation which counts, and this makes a massive difference because insulated needles protect the upper layers of the skin and allows me to deliver the energy where it's needed, which is the dermal layers. So with Infinity, as the name suggests, it's infinitely adjustable. I can adjust all the needle depth right down to 3.5 mil or go really superficial at 0.25 mil. And each stamp produces 49 little holes. And like I said, the main thing with this is the insulation of the needles. So sometimes I combine subcision as well in the same procedure prior to Infinity. You can see me subcising together with filling. And once again, it depends on the depth. Certainly if I fill at the superficial depth, I won't Infinity so deep in that area. If I put a lot of filler in a different depth, there'll be a difference. Subcision and surgical methods are extremely important for tethered and bound down scars. So one has to be well versed in regard to this. You can see me subcising here. So this is done under local anesthetic. Sometimes patients are under sedation. And here I am breaking down the bonds. You can actually see the acne bonds or acne scars being broken down underneath. This is a very important method to learn. And with linear scars, you need to operate. So certainly someone has to actually be very good at operating to help with linear scars. So I often combine surgery, subcision, TCA cross, all into one procedure. Laser resurfacing. Well, this is certainly very important to treat scars which are all at the same level. So here I am using a fully ablative erbium laser. This is a great technique for treating scars which are all at the same level. For example, shallow boxcar scarring or small open pores. Fractional lasers, I think these are great, but they're overrated, especially Fraxel. Fraxel is probably one of the most overrated lasers out there. It is a Swiss Army knife. It's good for doing lots of things, but not great for doing one thing in particular. So here I am using a laser, which is the 1550 Fraxel laser. This is great for mild scars, and like I said, it is overrated. It does help with scarring, but certainly if you use targeted approaches using many devices, it actually gives you a much superior result compared to just, hey, look, I'm going to put you on 4 or 5 fractal laser treatments. That's utter bullshit, because you will get an improvement, but you won't get the best improvement. Now, this is a fractal CO2 laser. This is totally different. It's using a CO2 wavelength. It's much more aggressive and better than the 1550. This is what I call freehand CO2. I use what's known as CO2 core. I prefer this method because I can actually control the amount of fractional laser I deliver compared to the fractal laser system, and it's more powerful than the fractal CO2. So freehand CO2 is what I use. This is fractionated erbium. I use less of it nowadays. Certainly it's best for darker skin types, but since the advent of Infinity RF, I've really replaced this. The next treatment is E-matrix. E-matrix is great for mild scars and early acne scarring. I don't use a lot of it for late acne scars because, like I said, I've got other better treatments, but this certainly is a good treatment for early scars, and certainly with our acne-free RF program. For later scars, I've got a lot of other devices. Okay, so what do we do for really deep ice pick scars? Well, the deeper the scar, the better the result with a procedure called TCA cross. That's TCA cross. There are a couple of ways to deliver this. We can deliver it using a toothpick system. I invented what's known as a syringe delivery system. I'm not injecting, so once again, I'd say I'm not injecting this into the scar, but I'm using this through osmosis and little droplets. So you can see how quickly I'm working just with a droplet area. And the whiteness will fade over 3 hours. Your skin will be red for approximately 5 to 7 days. And once again, the scars work really well for deep scars. Picot lasers such as this, we're using Picot lasers to treat early scars and brown marks like I showed you before. So picosecond lasers are excellent for treating acne together with acne scarring in ethnic skin types. A very good, reliable, predictable laser with minimal downtime, so an excellent laser overall. Now, there are certain new techniques over the next couple of months you'll see me doing. This will include the use of Infinity RF together with procedures such as PRP. So you can see me using PRP to inject underneath, but I'm also using PRP to put it in the droplets of micro channels which I've used. So guys, there you have it. That is how you should actually approach acne scarring, right? So it's never ever about the laser or the device. It's about how to approach your scars with the best method possible. So you always find the scar type, then you match it to actually a method, right? So that gives you the best results. No, hey, buy one, get one free type stuff, or hey, we've got this latest fractal or what have you. That is total and utter salesmanship, and it's bullshit. Acne scar revision in Australia is considered medical. So we don't consider that as cosmetic. It's considered medical. And if you are an Australian citizen or permanent resident and you hold Medicare, but the government basically gives you a rebate back. So the good thing in Australia, hey, we treat acne scarring as a medical treatment, and yeah, you get stuff back from Medicare. That's providing you see a specialist, of course. Look, hey, thanks very much for watching, and remember to subscribe for more information. One new video every Saturday morning Brisbane time, not Brisbane time as in Brisbane, Australia, not Brisbane, California. Catch you next week. Bye. For much more on acne and acne scarring and how I approach the scars, please go to lasersandlifts.com.au. Website's coming up very soon, so lots of information there and the newest techniques, videos together with procedures. Thanks.